My name is Krista McVicker. I'm a nurse with Bayshore. I've been working with Bayshore for about 11 years now in home care. I became a nurse because I was inspired by the nurses in the hospital. When I was a child and I was ill, I was in and out of the hospital all the time, and the nurses were what gave me that comfort. I felt secure and safe with them, and I grew up wanting to do the same thing for other people. I'm very passionate about home care nursing. I love it. It's where I'm meant to be. I was in university and we did several different placements, most of which were in the hospital setting. And although I loved it, I knew nursing was what I wanted to do. There was just something missing for me there. And when I did a community placement, that was when everything clicked into place. The thing about home care is that clients get to be in their home where they feel safest, most secure, happiest. So for me, home care was exactly where I should be as a nurse, and I've never looked back. What motivates me truly is the clients that we see and the patients that we have. They need you and they need that support. Once I get out there and I'm seeing the clients, I think that they teach me just as much as I help them with. So I feel very inspired by the clients that we see. They give me a lot of joy and fulfillment. I know we make a difference in their lives, but they do teach us a lot too. There's a lot of life lessons I've learned from our clients themselves. And I think what keeps me positive is just knowing that when I go to bed at night, I've made a difference, even in some small way in that day, of making someone's day better and helping them get healthier so they can return to, their day-to-day life as well. We do see a lot of senior citizens because they are who needs home care the most. They're homebound, not mobile, so we spend a lot of time with them. We see a lot of different clients with different needs, so it can be wound care, oncology, palliative clients, IV therapy, so we get a little bit of everything. I love working with seniors. They have a lot of wisdom and life lessons and little things to teach you, so I get a lot of joy out of that. I think what's helped me the most in my job is building those nurse-client therapeutic relationships. You can teach anybody to give an injection, clean a wound, change a bandage, but I think what separates someone from that and being a good nurse is if they connect with people. If you don't connect with people on a human-to-human basis, truthfully, I don't think you should be in nursing. I think COVID-19 has been a huge wake-up call as to why community care is so important, why home care is so important, because there was that fear of the hospital and the healthcare system being overburdened and collapsing with COVID-19. And I think it's been a huge realization that a lot of the care can be provided at home. With Bayshore, we can provide a lot of services at home for our clients. That they don't need to be in a hospital for, because truthfully, people feel safest at home where they have control over their environment, where they're happiest, they have their family members there, they have their support system. Even something as silly as their favorite chair makes them feel better when they're at home. And we can isolate clients much more effectively in their own home without burdening the healthcare system, because hospitals can be for emergencies. Home care can be for clients who are stable and can receive treatment at home. It's a good mix of safe, but also meets the client's wants and needs, because truthfully, I think all of us would rather be at home than in a hospital if we can. We also have the access we need to a lot of resources. We have access to the equipment that we need, the medications that we need, and we have access to still a multidisciplinary team. We can reach your doctor, we can speak to your case manager, your physiotherapist. We can all work together collectively to meet their needs and come up with a care plan that's best for them at home. I'm very passionate about home care, and I think Bayshore as a company, we do a really good job of keeping our clients happy, safe, and healthy. I love my career. It gets me emotional because I love it. I feel like as much as we help other people, I've learned so much over the years from the patients I've seen and the clients I've seen, and not just the clients, but their family members and their caregivers in the home. I mean, there are life lessons that I still think of that I've heard from a client or, years later still makes me laugh. And the connections you make with people, it's really special because these are people that don't know you. They didn't grow up knowing you. You're not friends necessarily outside of work, but yet you share this moment in time together and this connection, and they remember you, and it's really special. I feel really lucky to get to do the job that I do, and I feel really lucky to work for Bayshore. They've changed my life in a lot of ways, really amazing ways.